before we jump into the discussion of Birth of a New Brain, let's just get a recap of the book blurb.
When a new mother becomes manic overnight from a rare form of bipolar disorder, she stops at nothing to find the mental stability she needs to stay alive. After the birth of her baby triggers a manic maelstrom, Dyane Harwood struggles to survive the bewildering highs and crippling lows of her brain's turmoil. Birth of a New Brain vividly depicts her postpartum bipolar disorder, an unusual type of bipolar disorder and postpartum mood and anxiety disorder. During her childhood, Harwood grew up close to her father, a brilliant violinist in the Los Angeles Philharmonic, who had bipolar disorder. She learned how bipolar disorder could ravage a family, but she never suspected that she'd become mentally ill until her baby was born. Harwood wondered if mental health would always be out of her reach. From medications to electroconvulsive therapy, from redwood forest baths to bibliotherapy, she explored both traditional and unconventional methods of recovery, in between harrowing psychiatric hospitalizations. Harwood reveals how she ultimately achieved a stable mood. She discovered that despite having a chronic mood disorder, a new, richer life is possible. Birth of a New Brain is a chronicle of one mother's perseverance, offering hope and grounded advice for those battling mental illness. So one of the topics I think we wanted to discuss more was about the medication that Dyane has to go through to find one that works for her, and how she even pawns a wedding ring to try and find the right therapist to talk to get the right medication, to get the right treatment.
I think this also at this point is a good time to go back to her doctor at the time when she's being diagnosed with medical resistant depression for her bipolar. So she is working with a Dr. Ariana, and I think that's how you pronounce it. We will check. But he basically starts to get frustrated with the fact that she is medication resistant, as if she can do something about it.
Yeah, to the point where he even complains to
Craig, her husband.
Yeah, about the fact that, she just, nothing's worked. And actually, it's nothing to do with her as a person. She desperately wants it to work.
These medications are just not working. What more can she do?
I just think it's so... How can you blame the patient for the medication not working when it's such a complex mental health issue?
Well, yeah, you wouldn't necessarily... If someone broke their leg and it turns out that what you had done to fix it hadn't worked, would you blame that person? Probably not. No. So why is it different with mental health? That really upsets me. And I'm going to get my high horse as why do people automatically go, well, it's your fault that these aren't working, I'm now being frustrated. How do you think the patient's feeling? Do you really think she wants to feel this much depression? She's trying to run a family. She's trying to interact with her children.
Have a life.
Exactly. But there are days when she can't get out of bed because of the depression.
Yeah.
And she's taking the medication. She's doing everything they're telling her to do, but yet it's not working. I would be furious.
And I'm so pleased when she changes to Dr. Lathe. Again, I hope that's how you pronounce it. And he puts her onto a medication, still trying a few different things. And then he does some research and he actually puts her on a medication that is a first generation medication
for depression.
Yeah. And the reason it's not being kind of given as earlier, which Dyane says she's actually quite angry about, is because it comes with a load of dietary requirements.
Yeah, so the problem with this is that basically the individual who's taken, it's called a monoamine oxidase inhibitor, but the individual that's taking the monoamine oxidase inhibitor has to adhere to a set of rules because there are certain things that you cannot eat because it can cause repercussions to your brain health, and it can also cause organ failure in certain cases.
Yeah.
So because of that, doctors were less inclined to prescribe it because they were concerned that people wouldn't adhere to those dietary recommendations.
But she is so desperate to have something work.
I would do it. She would do anything. I would do anything. Yeah. I would be like, I will do whatever it is you want me to do to ensure that I am no longer in this state where I cannot function as a human being.
And she even says, like, she does miss some of the foods, for example, cheese.
Which is fair enough. I would too.
But at the end of the day, her mental health is more important.
Exactly. And with all the other stuff.
If I were diagnosed with diabetes, I'm someone who has a really big sweet tooth. So
doesn't she?
I'd really struggle with that. But I would do it for the long-term health that you need to have.
But then I guess there are a lot of people that don't.
Yeah.
Because unfortunately or fortunately, either way you look at it, there is a way that you can prevent the progression of diabetes with your diet. And a lot of people don't necessarily choose to do that.
Yeah.
And I think that's probably, I guess it's the same with mental health. There is a lot of things that you can do to help your own mental health. And it's a case of you needing to be proactive. And I think we see that with Dyane. She is so proactive with finding new research, identifying new things you can trying them out.
But sometimes she's so depressed she can't because she is so depressed.
Yeah.
She says that she can't lift a finger. She can't help.
Do the chores. She can't do anything. Exactly.
And to get somebody who is like that to adhere, I suppose, can be difficult. But she does have a good support system as well. Yeah. It's not like she is living on her own, having to make her own diet, which I believe when you have something like depression, it would make you harder to adhere because you would probably rely more on convenience food than actually making healthy food all the time. But she has a good support system. She has the lovely Craig, who really does support her through the whole thing.
And I can't wait to speak to Dyane about Craig.
Yeah, he does seem really lovely. So finally she is put on this, and with that and the lithium, and then also adding in a sleeping aid as well,
which is called quetiapine, or the brand name is Seroquel. So I actually take this, so I have first-hand experience. So she takes that particular drug for insomnia because what we see is that one of her triggers is lack of sleep. So obviously being a new mum, you're going to have a lack of sleep, which then impacted her time with mania and hypermania. But this particular drug, one of the side effects is it causes you to become drowsy. And taking Seroquel quetiapine has been a lifesaver just for me. And I'm sure it's probably the same for Dyane, is that this particular drug has meant that she's been able to maintain her mood.
Yeah. I think
because sleep is so important.
It is. Sleep is so important. And if you're not getting enough sleep, it can have a really detrimental effect.
Oh, it has a knock-on effect on everything.
There's been studies that say if you don't get enough sleep on a regular basis, you can start to hallucinate, you can start to have anxiety that is all linked to your body can't function properly.
Exactly. So sleep is important. That's all we can say.
I think the next bit I really wanted to talk about was linked in with the medication and coping mechanisms is hospitalisation.
Yeah.
Now, she does talk about some of her experiences within different units. She talks about how she's had 7 hospitalisations. But the major thing two major things I would say that I got out of this was firstly, some of the environmental issues with what hospitalisation is like and actually what is best for mental health patients.
Definitely.
And then second of all was the cost effect.
I think that's a huge factor. So in the UK, in comparison to the US, what happens here is that all of our healthcare is really free unless you go private, and that is your own choice. Whereas obviously in America, you have health insurance, but that can only go up to a certain amount. So you are then left with a bill of going into these hospitals.
Well, some of them don't even cover hospitalisation, she finds.
For mental health reasons, yeah.
And it's hard to get cover when you've had previous experiences, which mean that you're more likely to go into these sorts of things. Which is unfair. And then so there's this knock-on effect that means that she has all these payment plans with different units where she has to pay for treatment, but at the same time she can't work because of the depression and the treatment and the effects of her bipolar. So therefore she feels guilty because she isn't contributing towards the payments of something that's making her feel better.
Exactly. So that's going to add to your guilt and shame, isn't it? Just full stop.
Yeah, and it again puts more pressure onto Craig as well because he's got to work, and there's one moment where he's working a lot of the time and she feels that she can't say anything to him because although she needs help and she wants him around, at the same time she knows that he needs to work. So it must put a major pressure on...
strain on the relationship, isn't it? Exactly. And also the thought of, oh no, can we really afford this? Yeah. That's going to be another huge thing, isn't it? When you sit there and you go, I need some help, my mental health is deteriorating, but then you have to then question whether you've got the finances to support that need. You kind of go, well, that's really quite difficult, isn't it?
Yeah. I wonder, and this might be something we can look up later on, I wonder what the statistics of suicide are in America compared to the UK.
That would be interesting to do a comparison between the two. I'll see what I can find.
Because although the UK it is free, there is a difficulty in getting enough services. Yeah. And there's a lot of campaigning at the moment about how awareness is becoming better. People are talking about mental health more. However, the services that are available are still so restricted. I mean, the funding towards mental health has been reduced so much under the current government that it's actually really difficult to get help.
And I'd like to say that the NHS are doing a fantastic job with the resources that they have. It's not their fault that this situation has occurred.
No.
The problem is really from the lawmakers and the funders. They are the ones that are taking the money away and putting it elsewhere.
Yeah, I think the people that work in the NHS are amazing for what they do and the goodwill that they put in on top of their own job.
Because it's not just the fact that they're doing the hours that they're paid for, they're going above and beyond generally to continue to help people.
Yeah, and that brings us on to what hospitalisation was like.
Yeah, so it doesn't sound like a very pleasant experience for Dyane at all.
No.
And again, I have to say at this point that I haven't been hospitalised for mental health. Becky hasn't been hospitalised for mental health. So we don't have first-hand experience. But reading the experiences that Dyane talks about kind of makes your heart break again, because you are in such a vulnerable position, but yet you're put into an environment that is or sounds like the complete opposite for what you would need to improve your mental health.
Yeah, and she does say some things are changing in the more recent times, but obviously she's going back to the beginning of her story. And a lot of the things that we talk about are the first few hospitalizations that she has, and things like where she says you're not allowed outside, and this might be a safety issue and probably
it's probably a staffing issue as well.
Yeah, it's for ratios and things, but at the same time, you know, we've talked about how nature helps so much, and
exercise and being active and not being bored, because boredom is a huge trigger for anyone with mental health illness.
And she talks about how bored it is and how you don't think as you're being hospitalised, I should take a few books.
No, because you're in crisis. It's kind of like, it's not one of those things that cross through your mind. And even if you did take the books, are you going to be in the right frame of mind to be able to read and engage with those books?
Yeah, and she even says, like, there's no phone, there's no internet, and those sorts of things. Might be more change in that recently. However, she does say at the time there was nothing, and that meant that her support network disappeared overnight. Yeah, and actually support groups on the internet, as well as phoning relatives and friends, can be a massive help in getting you out of where you are and trying to reach the outside world again. She says it's very jail-like in its atmosphere, and she feels really claustrophobic, which must add to the anxiety as well.
But then I guess how much more would it cost for her to go into a unit that was more supportive of the mental health aspects?
But you would think if these things were in place, people would be in there less because they would recover maybe quicker.
But then I guess, I don't know, because again, the system is different in America.
Yeah.
If you think about it, America is privately run hospitals that are there to make a profit.
But she talks about somehow how she gets PTSD symptoms from actually being
in hospital.
Yeah, which to me seems
extreme.
Yeah.
Isn't it? It's just so extreme that
I don't think anyone should go into
hospital and come
out with PTSD. You know, it seems like a bit of a mad system. Now, what I do like is she has a ex-boyfriend that was also hospitalised in the same unit,
but in the male side, because they separate.
And a long time before she was.
Isn't he in at the same time at one point or not? I can't remember.
Yeah, the one I'm remembering is where she was saying how it was happened before and how she speaks to him, and because she'd actually offered her support when he was in there. So he actually sends her some practical items for her to use. So quarters, because the payphone is really important to be able to make these calls to family members, things like that. And also some lavender soap, because
which sounds kind of you go lavender soap, but again with the quarters and lavender soap, there are things that you don't necessarily think of whilst you're going into hospital, and probably people around you probably wouldn't have thought of that either. It's only when there's someone with first-hand experience that can go, you know what, this is what helped me.
Yeah, I mean, like we've said, neither of us have an experience of this. If I was to have a crisis moment and need to go to hospital for it, I wouldn't know what I would need because I don't know what it's like inside. So I do think, coming back to the hospitalisation, it does sound, from several of the books we've read now, that the American system doesn't seem the best, but I don't know whether we've just not seen the best examples.
I'm sure there's probably fantastic examples out there that we could read about, but as you said, we just don't know, and we apologise for, in some ways, our ignorance.
Yeah.
But reading these books, we are starting to get to know the system in America a bit better.
Yeah.
And also makes us go, well, in some ways, we may complain about our NHS because of the lack of funding that's going on. But I don't know how I would feel if I was in America, because there are times when I've needed quite a lot of mental health input. I definitely don't think I would be able to afford it.
Yeah. She does compliment Dr. King, who is in the behaviour unit. So we do have to say that, again, the staff are doing all they can, as much as they can. It does seem that there are some really good staff members in these places. Whereas the therapist, Dr. Arana, that she has, obviously we're not so keen on, but she does seem to find a few good people and a good therapist at times.
Yeah, and related to the hospitalisations, so because Dyane is medication resistant, she decides to proceed with electroconvulsive therapy, which is something in itself that is highly stigmatised. So Dyane talks about the view that people have of electroconvulsive therapy, which is that iconic film, One Flew Over the Cuckoo's Nest, when Jack Nicholson undergoes electroconvulsive therapy, and instead of it being a therapy, it is really being used as some kind of punishment because he's done something wrong on the ward. And
that's not what it's for.
No, exactly, and that's not what it is. And I'm really looking forward to be able to speak to Dyane about her experience with electroconvulsive therapy because of the stigma attached to it and just how she found it and just her experience.
She talks very positively about its effect on her depression, especially as she seems to see a fast effect in it lifting her mood.
And again, it has huge side effects. So for the first time she has electroconvulsive therapy, she goes with unilateral ECT rather than bilateral ECT because there are less side effects. However, later on with her depression that has deepened, she then goes for bilateral electroconvulsive therapy. But then you've got the issues associated with the fact that Craig still needs to work and you have an anaesthetic whilst you go through ECT, and she is told she can't drive.
Yeah. So the problem is that she
doesn't have the resources or anyone else to take her. So she has to, unfortunately, opt for the fact that she then, as a result, after having ECT, drives herself home.
Which my experience of ECT was...
Because you have had some experience of someone else having ECT, so you've seen someone who has had it and the after effects.
An ex of mine's mother went through ECT, and I remember going to the hospital with her and her going into a separate room. We didn't watch it or anything like that. Then her coming back, and the major side effect is the lack of memory. So she didn't know who her husband was. She kept asking about her ex-husband as if it was her husband. She recognised her son, but didn't know who I was, although she knew I was someone important and trustworthy. And that memory did come back over a few hours, and by the next day, she remembered everything, although she often forgot going and having the treatment. Which I think is probably a good thing, because I can't imagine that it is completely pain-free. I don't know.
Well, you're under anaesthetic, so you would assume that once you get knocked out, there's not much.
Yeah, but when you wake up, your body's been through something. So I don't know if you still feel some of that pain or a headache or a dull ache, because you are... I know when people with epilepsy go through a fit, afterwards their bodies are so exhausted that they often sleep.
Have some side effects.
Yeah.
Well, I guess that comes down to the side effects associated with ECT generally, doesn't it?
Yeah, a bit like when I have a migraine, I still feel it's almost like a hangover from the migraine for a couple of days when your brain is still dealing with almost a bruising effect. And I would be one of the questions maybe we can pose to her, that actually, what are the effects afterwards? What do you feel?
What did she feel?
Is it painful?
How long did it take her to recover from having the treatment and stuff?
Yeah,
I think that's definitely worthwhile asking.
It does seem that it must be quite an extreme treatment, but at the same time, if it's going to give you such good effects, it is worth it. And she does say that it's not for everyone, but it was for her. Another aspect we wanted to talk about was how there is a moment where Dyane is domestically abusive towards her husband.
But this is during a period of mania for her, so...
Yeah. However, it does mean that she is arrested and she is forcefully taken into hospital, which is for a specific number of hours. I think it's 72-hour hold, which it's only allowed when you become a danger to yourself or others.
And I think the reason at this point that Dyane is hospitalised is because she has come off her medication. And as a result of coming off her medication, it has triggered her mania. And so she ends up back in hospital and they put her back onto her drugs, don't they?
And I think that must be so difficult.
You're forcibly being dragged away from your children, from your husband. Yes, okay, she was having an episode which meant that she was probably a risk at everyone, and the fact that she also didn't take it seriously, because it starts off with her being or having hypomania, and then that trips into mania, and she says that she doesn't take the whole interview seriously. So when she's talking to the police officer, she has this smirk on her face, and the police officer notices that she's got this smirk on her face and she's just being a bit blasé about it. But again, it's in some ways I can understand why you would need to take someone who is at risk to themselves and to others away from the situation and help them. I get that. I also get that it may have to happen against their will. I get that as well.
But it doesn't seem that the police officer understands the smirking is related to her mental health. It isn't just her taking the mick out of the situation because she
is finding it funny, because she's not if she wasn't in this period of mania, she wouldn't be finding this at all funny.
And I think that's where
she talks about being mortified, doesn't she, afterwards?
And I think that's where police officers should have maybe more training on actually in these situations, laughing and things like that are not necessarily in the right context because of their mental health issues, and that isn't a comment on them as a police officer or at the seriousness of the situation.
I just think it's the fact that there may be a lack of training associated for people with these conditions, like the police officers aren't necessarily understanding what is going on. And as we said before, it is really difficult to understand someone else's mental health diagnosis. You haven't been there. It's a hidden illness. It's just not the same for you to read about it as it is for you to experience that situation.
And I don't think when you're going through these states, you can necessarily understand the effect you're having.
Oh, definitely
And
not.
so she doesn't necessarily understand how much of a risk she is in that moment. It's like when she is coming off the medication and she doesn't realise she's going into hypomania and then mania at first.
Well, again, as we said, it is a period that actually you kind of go, this is quite nice and I'm quite enjoying it. It's only the impacts later on when you've come away from that episode that you really start to understand what on earth has happened.
And one of the reasons when she is deciding to come off medication, she does it secretly, is because she's worried about being forcefully taken back into hospital. And unfortunately, it's almost a
catch-22, isn't it?
Yeah,
it's kind
it's
of
a
self-fulfilling prophecy and all of that kind of stuff.
Because it does actually mean that her husband is put in a position, and it must be so difficult for Craig to make that decision to ring the police on your wife.
Yeah, on someone you love and you care for, but I don't know.
And have them taken away from the family in that kind of situation. Are they ever going to forgive you for that?
Yeah.
And I think Dyane does, because she understands her diagnosis, and in hindsight, when she is out of the mania, she's able to look at it at a more objective perspective, I would say.
Yeah, once you are moved from the situation, it makes it easier to see the issues associated.
It's also, though, the strictness of the 72 hours, because actually some people it would take longer, some people it would take less. 72 hours, where did that number come from, I wonder?
Exactly. And I mean, we, again, at this talk that we went to, we heard them talking about the fact that, because we have something similar in the UK, it's a section 136 when a police officer determines that you are suffering with some kind of mental illness. And I mean, this law is really old. It was written in 1983, which is older than I am.
And me.
Well, that's because you're younger than me.
But it was. And there's actually a review going on at the moment in the UK of the Mental Health Act, and the fact that a lot of people say, because it was written that long ago, sectioning was meant to be done on a very rare basis, like a couple of times a year should you actually have to section someone. But nowadays, a lot of
statistics are huge at the moment.
At the moment, people are saying they're having to do it on a daily basis, and so it isn't fit for purpose anymore, because we've come on so far in probably in awareness, but also in treatments, and there's also been maybe an increase in mental health because of the current state of the country in some ways. I don't know, but I do know that it's being used maybe more than it was ever intended. And actually it needs to be reviewed and it needs to be discussed actually what is suitable, because in the UK it's 24 hours, not 72 like it is in America. But why is that different? What is the reasoning behind that? And again, is 24 hours enough? Is it that actually it needs longer or less, or should it be down to the doctor? And also you're handing all of your healthcare over to a doctor that maybe never even has seen you before and has never actually spoken to you or understood your journey.
Yeah, I think maybe this is something, again, just the whole act of sectioning we should talk to the secret psychiatrist about, because she would have had first-hand experience.
Definitely.
In the process, because we spoke on a previous podcast about her having to do a section 136 and it turned out the individual wasn't suffering from any kind of mental illness and they then assaulted a member of staff at the hospital.
Wow.
So I don't know what you would necessarily replace it with. I think that's going to be interesting, how they are going to redefine these laws and how those are going to work.
Yeah.
Because being carted off by the police gives you that impression that you are doing something bad and you are doing something wrong when it's something that you cannot help.
Yeah.
It is the fact that you are suffering from a mental illness that has put you in that position.
A bit like when they've had occasions when people who have diabetes and they have had an episode, and sometimes you can be seen as looking like you are drunk and grumpy and aggressive when actually it's because your sugar levels aren't at the right point.
You've gone into a hypo.
Yeah, and they've been arrested and not actually listened to or understood, and then they've had serious problems and had to be hospitalised. So there are lots of issues with, I think, using the police when it comes to a health issue that causes behavioural differences.
Yeah, exactly. But then I guess the question is, what would you replace it with?
Yeah. And at the end of the day, maybe you are protecting the wider population and there is a responsibility to that.
It's difficult, and I wouldn't necessarily want to be the people in charge of looking at this act to reform it. I worry
about the people that are, being that one of them did say that maybe we should stop campaigning about awareness because it's increasing the amount of patients.
Yes, that the reason why there is a mental health epidemic in the UK is because we're talking about it more, not the fact that actually more people are coming forward to talk about it and seek help.
Yeah.
But anyway, so I think we're coming on to the final bits of Diane's story, and I think it's important to really go back and examine what it was like for her during her childhood, particularly because her dad is also diagnosed with bipolar 1. And during her childhood, really what she says is that she is able to understand her dad's depression, but she also finds that she is the one that needs to try and improve his mood somehow.
Yeah, she feels responsible, as if she has to help fix
the problem.
Him and make him smile. And she actually even sees her dad go into hospital when she's about 16 years old.
And that must be quite traumatic in itself.
Well, she says it creates a fear of the mentally ill because of what she sees in that hospital.
Yeah, I also think that during her childhood, Diane says that she wasn't necessarily told that her dad had this mental health diagnosis. And I do think times have changed, but I don't think they've changed huge amounts. But being open about a diagnosis of mental health, how would that impact a child and how they view the world as they get older? Yeah. So, for example, if there was discussion about mental ill health, would this fear have developed?
Yeah, and would she be more aware of what hypomania and mania was if they had more discussions about it? So she would have noticed maybe after her first child the patch of hypomania that she has and what it was, whereas she doesn't really see that until she has hindsight of her second child birth and the consequences.
But then I guess in some ways, for me, I know specifically, I would kind of hide it and sweep it under the carpet, so to speak, because you don't necessarily want to admit that there is something going on. So you're just like, I don't know if I should say anything about it.
Well, she finds that a lot. She talks about how the stigma around being a mother is
mentally ill,
quite difficult. She worries quite a lot about being reported to child protection services and her children possibly being taken away from her because of her mental health issues. And I think that stigma starts from her childhood and how maybe she was treated. Not that she was treated badly, to say, as a child.
No, but
maybe just shut out from those talks and those issues.
Yeah, and also the fact that she is able to see the depression. So she talks about her dad reminding her of a hibernating bear because he goes to bed and stuff and he just can't function. And she gets to see that where the hypermania and the mania is really kind of, she's sheltered from that. It's really her mum that looks after those things for her dad.
She sees them argue quite a lot.
She does. Well. And I know from personal experience that arguments in the home isn't necessarily conducive to a stable environment at home. Not saying that this is the case for Dyane, but it must have been quite upsetting to see them arguing constantly about life in general.
Yeah. And actually, when she tells her father about her diagnosis, she's in a state of mania at the time, so it does mean that she reacts maybe not unnaturally. I don't want to say that.
She's excited and happy that she's finally got a diagnosis. There is a reason why this is happening, and she thinks that her dad is going to share the same response to her.
Yeah.
However, he's been living with the realities of this condition for years and years and years.
And you don't know what state she's in at that time.
Exactly. And he knows it's going to be tough because he's been through ups and downs, and he's been through the times when he can't get out of bed to go to work, but he's also been through the times when he has gone missing and work is trying to get hold of him and all of those kind of things.
And a mental health system that is 20 years before this, which as we know from the history of the mental health services, you go back further and there are, much harsher treatments as well.
Exactly. And you also have the shame and guilt associated with having a parent with mental health issues. So she talks about how she didn't necessarily bring friends home because she wasn't sure what state her dad was going to be in, which is a very common thing when you're young.
We're all embarrassed by our parents at certain ages.
I think
that's a given.
Oh, yeah. I think it's in all parents' job description. Be embarrassing to your children. But you kind of see the fact that she, not only is she in some ways ashamed by the fact that her dad is going through certain things, but she also has this sense of responsibility. And she's like, well, Dad knows what I'm going through. But he also feels guilty because of the issue with the genetics, and that if you are a first line relative, you are more likely to have developed the same condition as that relative.
Yeah, he actually apologises to her and says, I'm really sorry.
And she's like, no, it's fine, it's all good. But he's like, you know what, it isn't. You are seeing the world through your
mania.
Yeah, exactly. Your pink spectacles of everything is looking good. But when you come out of that mania, you'll start to realise how difficult this is going to be for you. And actually, we do see that.
We see a really difficult journey because she's also medication resistant.
Exactly.
She has probably a more difficult time
of everything. Exactly. So I don't know, I find it interesting because as a result of this, in some ways, because it was the time you don't talk about mental health issues, then that is perpetuating the stigma later on.
She does talk about how her mum writes letters though to his job and his work and explains the situation and actually saves him from getting sacked a few times because of her letters and her openness towards them about it. And yet when it comes to her own daughter, she can't find the words. I wonder, at what age do you start talking to children about mental health issues?
That is an interesting question, I think. And I think one that we will probably speak with Dyane about is how she handles now, from her own past experience of her parents handling mental health issues, how she then handles that with her children. Yeah. Because her children would have seen her in these periods of mania and these periods of depression. How do you then explain that to a child? And there is a particular part in the book that I thought was really interesting, and it's when she says that Mariella asked her if she would ever develop bipolar disorder, and she feels that she needs to be extremely open with Mariella, which is fantastic. And like Dyane is like, I'm sorry, I can't tell you that because no one knows. People just don't know whether that's going to happen. But if it does, we'll get through it. We'll be here for you. So that was Birth of a New Brain by Dyane Harwood. Sorry it's run a little bit longer than I intended, but I tried to get it down to 30 minutes. If you are wanting to get a copy of the book, please go over to our website where there is a link, and I'll also put a link in the show notes. If you would prefer to get this particular episode at the same time, so part 1 and part 2 all at the same time, you can do by going over to Patreon and becoming a patron of the podcast. And by doing so, you'll also get some extra material that didn't make it into the main feed of the podcast. On Friday, we will have a bonus episode where we interview Dyane about her book, which I would highly recommend. So until next time,
it's okay not to be okay.
And if you're not okay, talk. Thanks for listening to this episode of the Mental Health Book Club podcast. If you need additional help with your mental health, please contact the Samaritans on 116-123, which is a 24-hour helpline. And if you need additional information about mental health issues, please visit Mind at mind.org.uk. Our next book will be A Tiny Piece of Something Greater by Jude Sierra, and our next episode with Secret Psychiatrist will be looking at postpartum mood disorders. If you'd like to find out more about the MHBC podcast, please visit our website, mentalhealthbookclub.com. We really hope that you enjoy this podcast, and we would like to hear what you think. Please head over to Twitter, follow us at MHBC_podcast, or head over to Facebook and follow our Facebook page, which is Mental Health Book Club. If you would like to show your support further, please share us with your family and friends, and leave us a 5-star review wherever you get your podcasts.